Good afternoon, everyone. My name is Christina Gothier. I am PERA's Outreach Bureau Chief. Today we are joined by Jess Biggs from the New Mexico Retiree Healthcare Authority and Paul Liam from the PERA SmartSave Deferred Compensation Plan. And they are going to be sharing some additional tools that you will need to prepare for your retirement journey. And so I'm going to turn the floor over now to Jess.
All right, welcome everybody. Thank you for being here. Give me just a second to share some slides with you so we can speak to some information here. As Christina said, my name is Jess Biggs. I'm the Communications Director for Retiree Healthcare Authority. And it's absolutely my pleasure to be able to talk with you today, and thanks for letting me be here. Retirement's such an exciting time. You get to think about all the things you're going to get to do. And one of the things you're obviously thinking about is your pension and how you collect that pension as you retire. But one of the things that many people don't think about until at the last minute is how are they going to take care of their healthcare benefits? Right now, as an employee, your employer provides you those benefits. And every single year, your employer is going to roll out in front of you the different plan options that you can choose from. And with those plan options, you're going to pick which one you believe is the best one for you. You're going to live with it for the year. Your employer is going to pay a very large portion of your monthly premiums for that plan. And then you're going to pay the balance of that monthly premium through a deduction on your paycheck. And then you retire. And what are you going to do with your healthcare benefits? Well, that was the state of New Mexico had some insight and some foresight into the fact that those that do serve in the public, that when they do retire, they wanted to provide them opportunities to get quality and affordable healthcare options. And so 30-something years ago, they established the Retiree Healthcare Authority for that purpose. And the reality is we work very much the same way as your employer. Every single year, we're going to roll out different plan options that you can choose from. You're going to choose the one that you believe is the best one for you. You're going to live with that plan for the year. We are going to pay a portion of your monthly premiums based on your years of service, and then you're going to pay the remainder of that monthly premium. So again, it works very much the same way. And you can see some information on the screen here. I'm not going to go through all that information, but one thing I do want to say is when you look over there at the budget and finances, we do have a $406 million operating budget. And that's a lot of money. It is. At the same time, I want you to know that 99% of those dollars go directly in paying for the services that our retirees get. So as our retirees need to go to the doctor, as they ride in the ambulance, as they go to the hospital, 99% of that budget goes to pay for those services because we are self-funded. So it's just important to know. If you're interested in any other financial stuff, it's on our website. We're very transparent with all that. If you have insomnia one night, it's great stuff to take care of that. Now, who is eligible for Retiree Healthcare Authority and getting benefits through the authority? Well, anybody that is retired, you're actually retired, whether that's a normal retirement or disability retirement, you are drawing on your pension, in this case from PERA, and you have 5 or more years of service, you qualify to get benefits through Retiree Healthcare Authority. And you as the retiree can be covered. You can cover a spouse or domestic partner. You would have to provide documentation that partnership exists. And you can cover children up to the age of 26. And you can see there's a pretty broad definition of what is defined as a dependent child. So as long as you meet that criteria and you do have dependents that you want to cover, you have the opportunity to provide those benefits to yourself and to them. Now we have to talk about 2 categories of employees for a second. There are what we call enhanced employees, and there are non-enhanced employees. Enhanced employees are those that are police, fire, corrections, and judicial. Obviously, that applies to this group that we're talking to today. As an enhanced employee, you are making a slightly larger contribution to the Retiree Healthcare Authority while you are employed. And that contribution is a condition of employment. There is no opportunity to opt out of that as a condition of being employed. Your employer has chosen to participate. And so therefore you contribute 1.25% of your salary. So for every $100 that you earn, you're going to contribute $1.25. Your employer is going to contribute 2.5%. And as an enhanced employee, you only need 20 years of service to get the maximum subsidy for those monthly premiums. Here in a minute, I'll show you exactly how to look up premiums, everybody's favorite topic. In addition, an enhanced employee does not have a minimum age in order to get that subsidy. So said a different way, if you were fortunate enough to retire, let's say at the age of 46, you would get your subsidy from the Retiree Healthcare Authority at the time that you retire. And again, that subsidy would be based on your years of service, with a maximum being 20 years. Now, because this population is probably not non-enhanced, I won't spend too much time in here, but you can see that it's a little bit different, a little bit smaller contribution, but the number of years to get that maximum subsidy is 25, and there is a minimum age of 55 to get that subsidy. Said another way on that one, you could still come to the Retiree Healthcare Authority if you were retiring at age of 46, but you would pay 100% of the premiums until the month of your 55th birthday. And then your subsidy would kick in, again, based on your years of service. Now, once you become eligible and you come to the Retiree Healthcare Authority, and I should say this, you don't have to come to the Retiree Healthcare Authority for your benefits when you retire. It is an option, but you have the right to go get those benefits anywhere you would like to. You can go out in the marketplace or wherever you would like to get those benefits from, but we are an option when you meet those criteria that we've talked about. If you are retiring and you are under the age of 65, or you are not yet Medicare eligible and you come to us for benefits, you will be on one of our non-Medicare plan options for your medical benefits. And with that, you do see that there are 4 options currently that you can choose from. You can choose Presbyterian Value Plan or a Blue Cross Value Plan, or you can choose a Presbyterian Premier Plan or a Blue Cross Blue Shield Premier Plan. So 4 different options. Now, unfortunately, in this session, we don't have time to go through all those options, but you can get those if you go to that link on our website. You go to our website and go to Forms and Important Information. You can actually see these options and you can see the comparison side by side and how they compare in terms of things like copays and out-of-pocket maximums and all those types of details. And that allows you to do your homework of figuring out which plan you believe is the best one for you. If when you retire, you are Medicare eligible, for most people, that's going to be a 65th birthday or being older than that. Or even if you come to the Retiree Healthcare Authority and prior to being 65 or Medicare eligible, then once you become Medicare eligible, then you do have to move into a Medicare option. And so with that, anytime a retiree or eligible dependents are eligible for Medicare through either age, as I said, 65, or through a qualifying disability, or in some rare circumstances, end-stage renal disease, you would be qualified for Medicare, and therefore you would have to utilize Medicare, enroll in Medicare, parts A and B. And then Medicare would be the primary payer for all your services. Again, if you go to the hospital, doctor, whatever it may be, Medicare is going to pay first as the primary payer, 80% of the costs of that. And then it's very prudent and wise to have a secondary payer plan to help cover that other 20%, because we all know medical care is so expensive today. So again, that's where Retiree Healthcare Authority can be that secondary payer. And we do have Medicare secondary payer option plans. You can see here we have 6 options. We have a Medicare supplement plan from Blue Cross Blue Shield. And we have 5 different Medicare Advantage plans from either Presbyterian, Blue Cross, Humana, or United. And again, all these plans are just a little bit different. They're going to be designed a little bit differently to meet a lot of different needs that people have, because there's a wide spectrum of medical care needs that people may have, as well as a wide range of different budgets that people have. And so with the combination of those, there are different plan options that you can go through the exercise of comparing, picking which one you believe is the best one for you, and then having that plan for the year. And again, you can go to our website, you can download the comparison tables so that you can see what these plans look like in terms of all the details, the copays, out-of-pockets, etc. Now, this is a fun table. This is everybody's favorite topic, which is premiums. This table, if you can read this, you probably don't qualify for retirement. You probably should keep working. But when you look at this table, it's really, although it may not be easy to read, it's not complicated. Where across the top, you're simply looking at your years of service. And it's important to note that there are two different tables. The one I'm showing right now shows 25 plus years of service, which, as you just learned a few minutes ago, would be for the non-enhanced employees. Most likely, this audience today are enhanced employees. You only need 20 years of service. So we're going to look at the table that says 20 plus. And by the way, I should mention, again, the enhanced employee is police, fire, corrections, or judicial. That means the people that actually work in those specific roles. If there are staff that work within the court system or within the police system, the staff generally is non-enhanced. But if you want to know for sure, you can go to your HR and identify specifically, or you can look at your pay stub. And when you look at that New Mexico retiree healthcare deduction, you can simply do some simple math to see what percentage of that as compared to your gross salary. So a couple of ways you can figure that out. But most likely this group, this audience is enhanced, and so therefore we're using this table. Again, you can see years of service across the top. Across the left-hand column, we first see the non-Medicare options. There's that premier plan from either Blue Cross or Presbyterian, the value plan from either Blue Cross or Presbyterian. And then below that, we see those Medicare options that we briefly highlighted. And so now you simply pick the plan that you're considering. Let's say it is the value HMO from either Blue Cross or Presbyterian. And if you're the retiree with 20 years of service, you simply follow that line over to the far right and you see under 20, that particular plan would cost you $270.19 per month as a monthly premium. You also would want to look at a spouse or child rate if you're going to cover spouse or children, and you do have to add those numbers together. We do subsidize the retiree the most. We subsidize the spouse some, but not as much. And there is no subsidy for the children. You are paying 100% of those premiums, but you do have eligibility to cover those children up to the age of 26. So with that, you would know exactly how to look at this table and figure out as you begin to plan for your retirement and whether you are non-Medicare when you're going to retire, or if you're going to be Medicare eligible, you can then plan for what those premiums would cost you in terms of monthly premiums. Now, in addition to medical benefits, which is what we've talked about so far, you also have access to voluntary benefits through Retiree Healthcare Authority. You can get vision benefits. Currently, the vision carrier is Davis Vision, which will cover exams and eyewear. Or you can get dental benefits. You can choose one of two carriers. For dental, you can either choose Delta Dental or Blue Cross Dental, and both have a basic coverage, basic plan, or a comprehensive plan. It will cover a broader range of services, including orthodontics. So you could determine which of those meet your needs the best. In addition, you have access to life insurance through the Standard Life Insurance Company through Retiree Healthcare Authority. Just so you know, those are term plans, term only. And when we go to the next slide, you can see what those rates are for those plans. For voluntary, there is no subsidy. The subsidy for your years of service only applies to the medical. It does not apply to these voluntary benefits. You do pay 100% of the premiums for these, but you can see in most cases, we're not talking about large amounts of money. And just so you know, the life insurance, as you can see, is based on the value of the term policy in addition to your age. So you can see what those look like in terms of premiums. Also note that the voluntary benefits are not connected to your medical benefits whatsoever. So you can choose to take just medical from us and not take any voluntary, or you can choose to get medical somewhere else and only take voluntary. And you can mix and match those however you want, only vision or only dental, or, you know, combination of those. So you get to choose how you want to approach those. Some other important information to know is that through the Retiree Healthcare Authority, every single year we have what is called switch enrollment. What that means is every single year in the month of October and November, you have the option to look at the plan options for the coming year and switch to a different plan if you would like to. And there are no questions asked in those switches. You can make that switch every single year because needs change and budgets change and your health may change. Where you live may change. There's lots of circumstances that can change. And so every year you are allowed to switch to a different plan. No questions asked. In addition to that, we have what's called open enrollment. Open enrollment is when you voluntarily choose not to take benefits from us. And in that case, if you wanted to go somewhere else, which you have every right to do, you can go out and get your benefits somewhere else. And sometimes maybe you've taken your benefits from us and then you decide you wanted to cancel those benefits. You have every right to do that. You can cancel. People break up with us all the time. You say, I'm breaking up with you. I'm going somewhere else. It's you. It's not me. And they break up and they go somewhere else. But guess what? We're always going to take you back. Isn't that so sweet? We're always going to bring you back because this is a lifetime benefit to you as a retiree and to a surviving spouse. So even if you as the retiree would have passed first, a surviving spouse would also have access to these benefits for their lifetime. However, you can only come back during open enrollment, which is every odd year. So we just had an open enrollment in January 2025. The next one won't be January until 2027. Every odd year is open enrollment. We've already talked about the minimum age and years of service for this group, this population. For most of you, it's going to be 20 years. You don't need to meet that minimum of 55. I just have it up there to make sure that people are very, very aware of those situations. And just a reminder that if your contact information, once you do come to us, if that changes, make sure you keep that up to date. The other thing I'll mention and talk about just real quickly before we start to wrap up is that in some situations, people will choose to retire. And upon their retirement, then they maybe have different options for their medical benefits. Obviously, retiree healthcare is one. But in many cases, you might have a spouse that is still employed. And so with that spouse's employment, it may make sense for you to go onto your spouse's plan and get the benefits through your spouse's employer. And generally, that makes a lot of sense. That's probably going to be a better deal because if you think about insurance and the way it works, it's often the rates are based on the average age of the group that's being insured. So when you consider a employed group where average age is anywhere from 18 to, let's say, 60 something, right? 70, that average age is going to be much lower and the risk and needs are going to be much lower than the average age of a retired group. So it's often very beneficial if you have access to an employer's benefits, a spouse's benefits through an employer to do that. And then when your spouse finally is not employed for whatever reason, they decide to retire or they quit or they get fired or whatever it may be, you've lost your benefits. Therefore, at that time, you could come to us and get benefits through us for either you as the retiree or in addition, the spouse. So that's an option. Now, maybe when you retire, you also decide that you want to go back to work somewhere. If you do, and that employer does offer benefits, you are required to take those benefits as primary payer. And then if you wanted to keep benefits with us or utilize our benefits, because you are eligible if you meet those conditions. But we would be a secondary payer in that case, and that is a requirement. And again, it's usually more beneficial. And honestly, in most cases, it would not make a lot of financial sense to be under an employer's plan and have us as a secondary payer. Not many cases that would make a lot of sense in terms of finances. So just something to consider, but that is an option for you. So just wanted to make sure you understood that. The only other thing I'll mention before we wrap up here is that, and if you don't remember anything else I say today, this is the one thing you do want to remember. When you decide to retire, and you pick that retirement date, whenever that is, and for our intents and purposes at Retiree Healthcare Authority, it is the date in which the last day you will get benefits through your employer. Because what we don't want to have is a lapse in your coverage. We want to make sure we have continuous coverage from your employer to the retiree healthcare. So with that, you need to circle that date on your calendar. When's the last day you get benefits through your employer? You then need to back up 30 days and circle that date on your calendar, because that is your deadline in order to get your paperwork into Retiree Healthcare Authority so that your benefits will take effect the day following your last day of benefits with your employer. If you miss that deadline, you have to wait for open enrollment, which, as we've already talked about, is only every odd year in January. So that could be up to 2 years of wait time to come to Retiree Healthcare if you miss that deadline. So just don't miss that deadline. It does take a little bit of work. You're going to go to our website and download the general enrollment packet. There's a little bit of work to do there because you got to validate your years of service, which you're going to do for PERA anyway, but you need to provide that to us, and things like, marriage certificates if you're covering dependents, or birth certificates, etc. So a little bit of work there. Don't put it off to the last minute. Make sure you're working on that well in advance of your retirement date. So the last thing I want to mention, and then we're going to, I'll answer any questions you may have. Retiree Healthcare Authority does have a trust fund. We've been building this trust fund over the years to be able to sustain this program and these benefits for both current retirees and future retirees. Right now, we have 63,000 retirees taking benefits through Retiree Healthcare. We have 93,000 active employees who expect this benefit at some time in the future when they retire. Our trust fund has grown significantly over the last few years. Our board of directors and staff have done a really good job in managing that, and it currently stands at $1.6 billion. That is a lot of money. There's no doubt by any stretch of anybody's imagination. However, that still means we are 56% underfunded for our liabilities in the future. And secondly, currently, the state statute for the Retiree Healthcare Act states that those funds can be utilized for other purposes by the state of New Mexico if situations warrant. So therefore, currently, we have a joint resolution. It's called Joint Resolution 2 in the state legislature, currently going through the process so that to try to protect that fund under the New Mexico Constitution, so that those funds cannot be used for any other purpose. The reason I mention this is because this is critical to you and even your future for these benefits. And so we would ask you to support that legislation. You can go to our website and you can learn about it. You can go to the state legislation website and you can see what how things are progressing through the different committees, and once it finally hits the Senate floor and beyond. So we would encourage you, again, to please support this legislation. So with that, I'll just say that you can always get help. You can come to our Albuquerque office on Jefferson, or you can go to our Santa Fe office. We share a building with PERA in both locations. We actually have a phone. You could call us up if you need to, or email us, and we would be very happy to help answer your questions as you prepare for retirement, and as you think about your healthcare needs and your medical benefits. With that, that's the information I have for you today. And so I will entertain any questions.
Do you want me to read them out loud?
No, that's okay. I can do that. So we got a few questions in the chat here. James says, if I'm a Medicare eligible when I retire, but my spouse is not, what options do I take? James, in that case, you are going to be on a Medicare plan option and your spouse is going to remain on a non-Medicare option until she becomes or he becomes Medicare eligible. So you're just going to be in different buckets until both of you are eligible, and then that both of you would be there. Judge Alan Smith says, how's the calculation of years of service when you have contributions under both PERA and JRA? For our intents and purposes, we're looking at the contributions you make to Retiree Healthcare Authority. So even though you may have contributed to different pension systems, our years of service that we're going to calculate your premium subsidies on is going to be based on the years you actually contributed to retiree healthcare, because we're completely in separate funds. So I hope that answers that question.
This follow-up is in the bottom section.
Let's see. Follow-up is, as an example, 10 years under PERA, non-enhanced, and 11 years under JRA enhanced contributions. I'm going to have to be honest, Judge Smith, I'm not quite sure how that gets calculated. I would be very happy to follow up with you, and or I'll just give you my email address verbally, and if you wanted to write that down, I'd be happy to follow up and get you an answer to that. My email is Jess, J-E-S-S, like Jesse, Jess.Biggs, B-I-G-G-S, at rhca.nm.gov. So the back end of the email is just like that you see on the screen, like our website. But if you would email me or customer service, either one, we could specifically answer that question for you. Looks like we only got those 3 questions in the chat.
Excellent. If anyone else has any additional questions, you can drop them in the Q&A, or you can raise your hand as a participant, and we'd be happy to give you the ability to ask your question live. I think you might be off the hook, Mr. Jess.
All right. Well, thank you very much, everybody. Wish you the best in retirement, and as you plan for it, we're here for you as you need us. Have a great day.
Awesome. Thank you so much. We appreciate you. Did you go to your USB? Do you need it for the next? Thanks. All right. So, as I mentioned, our second presenter this afternoon is Paul Liam. He is our PERA SmartSave Deferred Compensation Representative. We've got a couple of different slides kind of floating around. Do you want me to start with the limits and contact information, or okay? And then if you,
are you controlling or am I?
This is all you.
Okay. Just the arrow button, right?
Let me just do.
Oh, perfect.
Oh, I clicked too many. There we go. So the other chart we talked about is in a different piece of software.
Oh, so we can't do
if you need me to help switch, let me know.
All right.
All right, ladies and gentlemen, Paul Liam, PERA SmartSave Deferred. Oh,
Sorry, technical difficulties. I'm too tall, so we had to put a chair in here. So thank you for attending. And Christina, thank you for organizing this. It's a lot of great information. So I hope you guys are getting ready to prepare for retirement. What I'm going to talk about here for the next few minutes is your defined contribution plan. So Christina and her crew went over your pension, which is a defined benefit. You work X number of years, you get X number of dollars for the rest of your life, one of the best in the country. So what this is a supplement to that. So it's an optional supplemental retirement plan, very similar to a 401k. It's actually a 457B, but most people are not really familiar with that number. The primary difference with the 457 is that it's tied to employment, not age. 401ks, 403Bs, IRAs, all of those other plans have that 59.5 rule, which means you're penalized if you take it out early. Deferred comp does not have that. It's tied to employment. So the second you leave, that money is available without a penalty. So that's the big benefit. The flip side of that, though, it is more restrictive while you are working. So I like to make it clear up front, this is not a savings account. It is a retirement account. So there's really only 4 ways you can access that money while you are still working. The first one has 2 parts to it. It's called an in-service distribution. So if your account is less than 5,000, you stop contributing for 2 years or more, you can take it out. No hoops you have to jump through, but you do have that 2-year window in that one case. They added a second part to that last January, so we've had it for about a year. But now if you are age 59 and a half, you can actually take money out of this plan, but you can actually continue to contribute as well, which has always been kind of the sticky point where accounts were either open to accept contributions or closed for payout, where this would allow you to actually do both. The third way is what they call an unforeseeable emergency. So that would be medical bills, repossession, foreclosure, natural disaster. So really bad things. So if it's a qualified reason, they'll release any amount you pay out of your pocket. Last way is a loan provision, because again, we can't pay you until you leave. So they built in a provision where you can actually borrow money from yourself at a low rate. The rate will be prime +1, but the full payment, the principal, and the interest go back in your account. So those are the 4 ways why you're working. Again, once you leave, you can do whatever you want. So the limits just were announced. The limits for this year, the regular max is 23,500. The maximum goes up at age 50. That goes up to 31,000. They built it, and this is a new provision, so many of you may not be aware of this, but they built in a second catch-up provision for people between age 60 and 63. You can actually put in up to 34,750. The special catch-up's always been around, but that limit did go up as well. So it's double the regular max, or 47,000 for 3 consecutive years before you are eligible to retire. So when we start talking about leave, actually with most of you, that leave balances won't be a factor, but we'll talk a little bit about it anyway. But sometimes those come into play. So those are the maximums. Again, the minimum is $10 per pay period. So you have a tax advantage way. How do I get that other slide? So I'm going to give you guys an example. So what you have here is a tax advantage way to save money for retirement to help supplement that fantastic pension you guys have. So for easy math, I tend to use $100 just because it's easy math. And we're going to get an example here. So you have 2 ways to go about it. And I'm looking at that chart in the middle right there. So if we do $100 per pay period, most of you are probably in the pre-tax if you've been in it for a while. The Roth was added about 5 years ago. So that's another option. And we'll go into the difference here in a second. So if I do $100 a pay period and I do the pre-tax version of the plan, that's not going to impact my take-home pay by 100. It's really only going to impact my take-home pay by about 75. I'm not going to pay that $25 upfront to Uncle Sam. I'm going to invest the full 100, but it's really only impacting my take-home pay by about 75. There's no accounting I need to do, but it'll be the difference between box 1 and box 2, your W-2. So when you're doing your taxes, you are getting that tax advantage as you contribute that money in the year you contributed. $100 a check, $2,600 over the course of the year. You read the fine print, they're assuming a 7% rate of return. And as a long-term number, that's definitely realistic. We're kind of climbing out of this downturn. The last year and a half has been pretty good, but the 3 years before that, not so much. But even at that low point, we're still averaging over 10. So as a long-term number, 7 is definitely realistic. Again, just a math equation, $100 a check. I do that every pay period for 10 years. I average 7%, I have 37,000. Not bad. 20 years, I would have 110. 30 years, $250,000. So the trick there is I got the tax advantage as I contributed that money. So now as I withdraw it, I will pay the taxes at that point. So with most, and you guys may not be in this situation, but with most state and municipal employees, we see you stay in the same tax bracket, if not go down a tax bracket. So that's the idea there. You pay the taxes below the tax bracket. If you're going to be in a higher tax bracket when you retire, then the Roth makes a lot more sense. So the Roth is exactly opposite. That's an after-tax version. So if we use that $100 example, that $100, if I do $100 to Roth, that's going to impact my take-home pay by $100 because I am going to pay the taxes up. So for illustration purposes, I always look at the accumulation on the line above it. So the Roth, I paid the taxes up front. So I'm paying that $25 to Uncle Sam. So really, I'm only going to invest 75. So if we look at that accumulation, that'll kind of closely correspond with what's going on. So in 10, I'd have 27, almost 28 in 10 years, 20 years, 83, 30 years, 190, but I will pull that out tax-free. So if you're going to be in a higher tax bracket, that makes a lot of sense. Get the taxes out of the way now too. So the maxims I talked about apply to both. So you can use a combination of the two. You can use Roth pre-tax, but the maximum contribution between the two, the regular max is going to be 23,500. So you have the option of doing that. All right, so that's how it works. We always say start with something you're comfortable with. Hopefully you guys are all involved with this plan already. If not, it's never too late. There's a couple other arguments I'm going to give you guys for the pre-tax version. If anybody needs to buy service credit, and I know Christina and her crew talked about that already in their seminar too, but if you need to buy service credit to get out earlier, you can now use your deferred comp to do it. If you're going to do it, you want to use the pre-tax version. That way it's a tax-free transaction. So there's not many tax-free things out there. So if you're going to buy the time, again, it's pretty expensive. So that's your decision to make, but I would at least consider using my pre-tax version of the deferred comp to buy it if I'm going to do that. And again, just to highlight, the 3 types of service credit you can buy are forfeited time, meaning you worked it, you left, you took it out, and now you're back. You can buy military service, up to 5 years of active military service. You can buy that as well. And airtime, anybody's allowed to buy up to 12 months. So if you're going to buy it, my takeaway is look at using the deferred comp to do it. So that's kind of the nuts and bolts of how the plan works. This is more of a retirement meeting. So I'll go into a couple of things. The main 3 things that we're going to want to look at from your end. Number 1, buying sick and vacation time. And I know judges don't get that. So in case anybody, if it does apply to anybody, if you do have sick and vacation time at the end and they're going to pay that out to you, if you take that payment directly, you're going to be taxed very heavily. It's the rule of thumb I got is roughly 44%. So what a lot of people choose to do is roll that into their deferred comp, where we will still withhold the FICA amount. So Social Security, Medicare will be withheld, but that's roughly 8% versus the 44%. So much better. We roll that in there, then we pull that money back out as ordinary income. So if you get the sick and vacation, that's a great use for that at the end as well. And when we talked about those max, a lot of times that will come into play too. So that's the most time sensitive one. So if you are in that situation, let us know. Ronnie, myself, or Peter are more than happy to help you with that part of it. But if you have those leave balances, that's the most time critical piece. Aside from that, it's pretty flexible. So basically, once you leave, the state is going to upload your termination information to Voya. So once that is done, they will do that when you get your last check. Once that information is uploaded to Voya, all you have to do is call the call center and tell them what you want to do, and they will send you a check. I do have paper forms if you want to do it that way, or the website, but it's very easily done. The thing to remember there is if you use the pre-tax version of the plan, you did not pay taxes on that. So you will be taxed as you take it out. The IRS mandate is 10%, or 20%. So we have to withhold 20% off the top. So just keep that in mind. If you say, I want $10,000, you're going to get a check for 8. You'll get a 1099 at the end of the year saying you took a $10,000 distribution, but $2,000 was already paid in taxes. We do not withhold state. We can, but that's under your direction. New Mexico is not a mandatory state withholding state. So we don't hold that automatically. If you want to request that, they can absolutely do that. So when you call them, you can tell them that, or you can actually put it on the website as well. So that's the second thing. The last thing is your investment. So, most people join those target date funds, and that was a great option. That's one of the biggest enhancements, in my opinion, they've ever made in this plan, because they kind of take that time sensitive approach. So they base a portfolio based on your age, and they make systematic changes for you. So if you're in one of those, you're probably in the right spot. But if you created your own portfolio, a lot of times what we see is people create this great portfolio when they first got hired, but they never go back and look at it. So now your goal is a lot different. When you started, the first thing, the goal was how big can we grow this thing? Where now it's like, let's take a safer approach and let's make sure we secure some of that principal so we don't go through another big downturn right before we take it out. So aside from that, those are the three main things you're going to want to talk to us about. But aside from that, the ball's in your court. So we can do this however you want. One thing I always like to mention, the fourth thing actually, is the beneficiary. We need to make sure that's up to date. And I know Christina already talked about that, because we're both big proponents of that. The biggest sticky situations I've seen with this plan are people that did not update their beneficiaries, because we have to pay out who's ever on file. So, if their first name is X, you probably don't want them as a beneficiary. So let's make sure everything's up to date. But those are the 4 main things we need to talk about. That's about all I have. If you're not involved, I encourage you to do it. Even if you have a short amount of time, we can still do the leave balances if that's an option for you. But aside from that, I'll stand for any questions. Okay.
Just in case you couldn't hear me, just a reminder, you can drop any questions for Paul in the Q&A section or raise your hand and we will unmute you so that you can ask that question live. If you would like us to put back up the contact information for the other representatives across the state, we can certainly do that. And, you know, all of them are amazing, very knowledgeable, and are happy to help. Let's take a peek.
Oh, that's a good point. I should have brought that up. So yeah, not at retirement. So again, from the time you leave, that money is available to you. But at age 73 for this current calendar year, at that point, from the time you leave until age 73, you can do whatever you want with this. At that point, Uncle Sam steps in and says, you know what, you haven't paid tax on any of this amount. So you have to begin what they call minimum distributions. So at age 73, you will have to begin what they call minimum distributions. It's roughly 4% the first year. That will increase as you get older, because you will actually liquidate this account from the time that you're 73 to age 99 and a half. So every year that goes up a little bit. So there's no calculation you need to do. You know, we'll send you a letter. I think they go out in the middle of the year, but it basically says you have to take out X amount this year. If you don't direct us how you want to do it, we're going to send you a check in the middle of December. So you don't have to calculate it. They will do that. That number is stepping up. So if you're a few years away, it'll probably be age 75 by the time you get there. But it is there is an increase in that minimum distribution age. Very good question. I should have brought that up.
All right. Any other questions for Paul? In a normal presentation, I would volunteer to be your beneficiary, but I don't actually want to end up in front of any of your benches. So I think we are good to go from there. Let's see, one more question. Oh, we answered that one live. Okay, so the question Paul just answered, is there a minimum distribution at retirement? We've got that covered. Can't think of anything else. This is the smartest way to put away pre-tax dollars. Everything that you are funneling after tax dollars, obviously pros and cons to both sides. But if April 15th is going to be a sad, dark day for you, this is a really great way to offset those taxes. And so if there are no other questions, we will let you enjoy the remainder of your lunch hour. And thank you all for joining us today. Please stay safe and well.
Thank you.
Thank you, Judge Bowman. We appreciate you having us and look forward to helping you all learn more about your retirement benefits in the future. Take care.